You're listening to the Modern Therapist Survival Guide, where therapists live, breathe, and practice as human beings. To support you as a whole person and a therapist, here are your hosts, Curt Widhalm and Katie Vernoy.
Welcome back, Modern Therapists. This is the Modern Therapist Survival Guide. I'm Curt Widhalm with Katie Vernoy. And if you do us a favor, wherever you listen to your podcast, if you go over and leave us a rating and a review, it definitely helps us out. And today we are joined by Laura Westmoreland. She is an LMFT in Century City, California. And we are bringing her on to help us increase where we are looking for the diverse issues that come up in everybody's practices. And Laura brings a very cool, unique specialty and a very awesome viewpoint on body diversity. So thank you very much for joining us, Laura.
Thank you for having me.
We are very excited to have you. And as we ask everyone, who are you and what are you putting out in the world?
Well, as Curt said, Laura Westmoreland, licensed marriage and family therapist in private practice in Century City. And what am I putting out in the world? Hopefully inclusivity, specifically around weight and different body shapes and sizes, and working with folks who may be struggling with weight-related concerns or have experienced weight stigma. Also with clients who have eating disorders or body image issues, and the other therapeutic types of things like relationship issues and anxiety and depression.
I think that's awesome. I think it's definitely something where the more I talk with HAES or Health at Every Size informed clinicians and kind of see the diet culture and all the stuff that's around, I recognize how needed this is. But I think there's a lot of people who don't know much about it. So if you could maybe talk a little bit about body bias, health at every size, like what are the things that therapists should know about what you're talking about? Because I think it's something that can oftentimes be missed.
I think that a lot of times that as therapists, we have training on different types of diversity, ethnicity, gender, religion, but it's often overlooked to talk about different shapes and sizes of people's bodies. And living in a larger body can present a challenge in that it's, you're not physically supported sometimes in the world in terms of like airline seats, restaurant seating, even seating in therapist waiting rooms, or even seating in the actual therapist's office. So that's a consideration. One thing is about how we move through, and I say we because I do live in a larger body. So that's one of the ways that I identify as I live in a larger body. Just thinking about how you move through the world in a larger body, and thinking about you step out your front door and you walk into a war zone with the war on obesity. And even the term obesity and overweight is medicalized and pathologizing you right off the bat. So it's a lot to take in as somebody who is in a larger body. And then thinking about body bias, that's what I call any feelings that we may have towards someone else's body, be it whether they're thin, they're in a larger body, whether they have piercings or tattoos. It's like, what are our biases? What stories do we tell ourselves about that person just based on how I'm going to say size them up, which is essentially really what we're doing, sizing them up.
Yeah.
And I think that not only is this a socially, valid concern and a great social cause that you're getting behind in the work that you do, but I think when it really comes back into the way that we look at training therapists is that even in adopting a biopsychosocial model, that we do incorporate that medical aspect and have this ideal that what our clients should be engaging in as far as physical activity and what their weight may be contributing to depression or anxiety, looking at it as a causal factor as opposed to a symptom of what some of the emotions are that are behind it. And I'm tangentially into working with eating disorder clients. It's not part of my specialty, but my understanding is that some of this approach that you're talking about is even controversial within the eating disorder community.
I think any time that something that's presented is different from what we already know, there's going to be a little bit of controversy surrounding it. So that I definitely think exists, especially when we've had what I'll refer to as the medical model, which is very pathologizing. And it's something, quite frankly, that as therapists that we are involved in because working with insurance and having to categorize and label things, diagnose things. So that's part of it. Where I come in to looking at this is more about the client's lived experience instead of the pathologizing and the medicalizing. But there's some controversy out there, and in terms of health at every size, and there are studies that have been done that talk about BMI and obesity and overweight. And with any of the studies, it's important to take a critical eye to it and look at, what's the duration of the study for the outcomes? Is it over 5 years? It's also important to look at who sponsored the study and the number of participants that were studied. So I think that's also important when we're looking at the science behind obesity research.
I think for me, what I sometimes have a hard time sorting through, and I appreciate this conversation because I think it helps me quite a bit. When I think about the research, I think about the body bias, I think about how, as a society, we approach people who live in larger bodies. It's hard to sort through what Curt had said previously around, potentially it's a symptom. If somebody has a larger body, that could be a symptom. And I know for sure that in like the HAES studies that were done at Kaiser, there was, it was actually a weight loss study that found that this woman was overweight due to the protective factor of trauma. I don't want to have a body that could be sexually attractive to anyone. And so that speaks as a symptom, I guess. I don't know a better way to put that. But I also think that health at every size is talking about a healthy body at every size, and that it may be completely unrelated to psychological factors, what size you are, and that you can be healthy at every size. And I know that there's also people who are unhealthy at every size. And so to me, I have trouble sorting through how to approach this whole concept of what it truly means to be healthy at every size and how to help people be their healthiest self, because I don't want to step into kind of nutrition or diet. It's not my scope of practice. Diet meaning what you eat, not dieting. But I also don't want to shy away from something that may have real impacts on people in the world, because I think there is stigma and I think there is body shaming and I think all those things are real. And I want to make sure that I'm helping to address and assess and process the lived experience. And so I guess for me, and I'm specifically asking you, Laura, kind of your perspective on this, because I respect and value your opinion on this. How do you approach that huge array of context with a person who's living in a larger body, honoring their experience? What are the things? Because I think therapists get this wrong all the time. I'm absolutely sure of it. But how would you recommend therapists approach that to identify what is the most inclusive and positive way to talk about all the possibilities of what's happening with that client?
That's a great question. I think for me, one of the things that I do is really try to understand and what the clients, like I said, their lived experience has been, but to also understand like when someone comes in and goes, "Oh, I feel fat." Okay, what does fat feel like? What does that mean to you?
Mm-hmm.
And I know that I've actually done this before where I've worked with a client who was like, "Oh, I feel fat." And in my brain automatically goes to, "Oh, what about this diet? What about working out more?" And of course, I don't say that out loud, but it's just, I think that's so indicative of the culture that we live in, is that my brain automatically goes to fix it. And that, I think, is where some therapists may get it wrong, is that while we are open and accepting of a lot of other things that come into our rooms, that when somebody says, "I'm fat, I'm ugly, I'm not happy with my body," I think that we jump to, "Let's fix it." And so I think where what we need to do is, or I would invite therapists to do, is to really ask the client more about what would that look like for them, fixing it. What would losing weight do for them? You know, some clients may say, oh, it'll make me happier. Oh, it'll make me this. Oh, it'll make me that. But then if you think about, okay, so if this person's going to go on a diet, they are probably going to be restricting a lot of calories. They're going to follow maybe some trendy diets that are out there. And then they may find themselves restricting in other areas of their lives. And oftentimes, I think it was Deb Burgard who said, we prescribe for our larger clients exactly what we treat in clients who have eating disorders. So there's a really big disconnect there. So I would encourage therapists when they're working with clients in larger bodies to, ask the client, what does that mean to them? If the client says, oh, I want to be healthy, what does health mean to you? Because what we may think of as healthy, like maybe I go to the gym 5 times, or maybe I eat this type of food and I don't eat that type of food, that may not serve our client. And that may also really be colluding with diet culture. And that could be harmful for our clients.
I know from some of our conversations, and Laura and I have known each other for several years at this point, but some of our conversations offline have been really about some of your own personal experience in working with medical professionals and the way that you've been treated as really driving behind that this can impact treatment in the way that somebody first experiences a professional in responding to what their size is. And, I'm not asking you to share tons and tons of what your experience has been, but I do know that in so much of what we espouse here at Modern Therapist Survival Guide is about really living your personal experience through the professional work that you do. And having known you and having, really been around you as you've come into your own in this area has really been exciting. And having your story really does drive home just how important this is.
Thank you. Yeah, I will share a little bit. So like I said, I do live in a larger body, and I want to take a pause to talk about that, because some folks may identify as living in a fat body. Sometimes I'll say I live in a fat body. Sometimes I'll say I'm fat, but I don't like other people to say it to me. Mm-hmm. Or if I may say I live in a larger body. So I would also encourage therapists and medical professionals to listen to the language that the client is using about how they refer to their bodies. And then to not be afraid to ask, is it okay if I say that? I had a therapist who I say that I trained him on Health at Every Size because he was like, what size do you want to be? And I was like, I don't know, 0. Like, that's model size, right? But it didn't make sense in terms of my body and where I was. So there was a lot of learning opportunities in working with a therapist who really didn't understand what it was like to be in a larger body, and had, talked about diet and exercise. And at that point I'll say I'm in recovery from an eating disorder. I was a restrictor, which is really interesting because I do live in a large body, is that some folks may judge me as, oh, she's got binge eating disorder, she can't control it. So that's another thing that I would caution therapists about, is not to make diagnoses based on somebody's body size, because you might miss something. Anyway, moving forward, I found a Health at Every Size dietitian. I sort of accidentally fell into it, and have now embraced Health at Every Size in my life, which is about weight inclusivity and healthcare enhancement. So there's a social justice component of it, making access to care available for all bodies. I do intuitive eating, which is really paying attention to hunger and satiety cues, which was something that was new for me. Can you imagine having to learn when you're hungry and when you're full? So that's something that I also did. And then my favorite, joyful movement. I used to hate going to the gym, and I would beat myself up like, oh, you need to go to the gym. You need to go to the gym. I hate going to the gym. And so I have found my joyful movement as a ballroom dancer. So I'm a competitive pro-am ballroom dancer.
That's so awesome.
And thank you. And it really does bring me joy, and it's a lot of fun. So that's a little bit about my story and the things that I've found. And so I definitely want to share those with clients that I work with and help them untangle the knotted things that they've internalized, maybe around guilt or shame or weight stigma.
The piece that I'm hearing is that there's really some specific structure that you've put into your own life and that you share with your clients around how you can really get into a space of being very healthy. And it's not diet culture. It's not focused on a specific weight or number or quote unquote size, but it's about finding the healthy practices for yourself. And so to me, the piece I was hearing and the piece I want to kind of dig deeper into is this idea that there's assumptions made that if someone is living in a larger body, they're binge eating or they're out of control or, those kinds of things, versus you are actually very controlled and restricting. There's some pieces around how we set up our offices and stuff like that could potentially be not inclusive or welcoming. What are some of the other things that you want therapists to know as far as how to be inclusive for all body shape sizes, to really help include all people in their practices?
Well, I think one of the things is to have an understanding of what health at every size is and what it isn't. And there's a website that's by ASDAH, ASDAH, and I'll give you the link for that has a lot of information about health at every size. And it's a really good resource. But in terms of therapists, I think one thing I can say is to remain curious about the other person, about the client, about what their experience is like, and to not be afraid to maybe ask them about do they have any body image issues when we first see a client. That's one of the things that when I work with a client, I ask them any issues about their weight, about food, about their body image. And then I'll often ask a client, as I'm getting to know them, to tell me what the meals were like as they were growing up, because there's a lot of good data that you can get from listening to someone's story about their dining experiences as a child and with their family. And you get a sense of, was there food scarcity? Were they not allowed to have certain things, but maybe their sibling was? So there's a lot of good information that you can get. So I would encourage therapists to not shy away from talking about food and weight and how the client feels in their body.
Well, and I like the part about the question, how do you feel about your body? Not the assumption that there's going to be body image issues, because I think there are folks who are comfortable in their body at the size that they're at, and there's a lot of folks who are not. And I think even for folks who are living in smaller bodies, we shouldn't make the assumption that they feel good about their body either, or that they don't feel good about their body. I think that just really, that was the thing that really stuck out for me in what you were saying, is this idea of we need to really be curious about that person's experience, the person that's sitting across the room from us, rather than putting our own bias on it.
That's a really good point, as even in terms of somebody who may live in a smaller body. Because if you think about it, we go out into the world and we're inundated by images and billboards and ads that say, get a beach body, lose weight, get a perfect body, get plastic surgery, take this pill, take that pill. And so it can impact everybody, not just large people in larger bodies. So I think it is important to, ask those questions of people, anybody who has a body. Let's ask them how they feel about living in their body.
Yeah.
One of the things that we hit on a little bit earlier that I want to circle back to is kind of the therapist attitudes about body shapes. And one of the things that Laura had us look into is the implicit bias test. And I'm going to let her explain a little bit about this. Katie and I both took it, and we'll talk about our results, and Laura can make all sorts of judgments about what we came up with.
Well, I promise not to judge out loud.
All right. That's fair enough.
Okay. So the bias test, it's something that was put together. I think originated out of Harvard, and there are different tests that you can go on and take: fat versus thin, black versus white. There's a whole array of tests that you can take, and it basically, what it does is it looks at how quickly you respond, and that tells you where your bias goes. Surprisingly for me, when it came to fat versus thin, I was neutral. So I was kind of like, oh wow, that's interesting.
Show off.
I know, right? See, I'm living health at every size. Walking the talk. There's also, what's interesting is, I definitely want to hear about your results, but I just connected with a researcher from UCLA who does some pretty cool work around weight stigma and non-diet approach. His name's Dr. Jeff Hunger. Yes, Hunger. It's like the perfect name.
Oh, that's perfect.
But he sent me a research paper that was about this bias test, and they looked at all the data that was available, because it just aggregates all the data, and you can, if you geek out sometimes like I do, you can go download it and run studies against the data. But somebody looked at it over a course of years, and they found that, like, ethnicity and gender, the biases changed, but the one that didn't change was fat versus thin. So I thought that was pretty interesting.
Wow. Why do you think that is?
Why do I think that is? I think it's because we live in diet culture where it's, the thin ideal, and, have a thin body, be thin. I think that's why it hasn't changed, because we are inundated with messaging around living in thin bodies. And one of the things that I did want to go back and mention is that even if we look at words like obesity and overweight, that's still part of diet culture. And it's like, it's like a way to stratify people depending on, you're this, you're that. And it's based on BMI, which, don't get me started down that road.
Nope.
You can Google that one. There are a lot of good studies that have been done on the Asked Us site. But I would love to, now I'm kind of acting like the interview, I would love to hear how you all did on the test. What were the outcomes for you?
So my results came back as a slight automatic preference for thin people.
And mine was a slight automatic preference for fat people.
And what did you feel about when you got the results? Were you surprised, or anything that came up for you?
For me, I don't think that I was surprised, and kind of looking retroactively across my life as to where this likely has a lot of influence is that, having been very involved in sports, and especially some weight stigma sports like wrestling, where we were weighed several times a day, that really did have an impact on what my attitudes were. I know that I've also had my own weight issues throughout various aspects of my life that are constantly looking for, a thinner, better looking body.
That's very interesting. I feel like jumping in, it feels too quick. I want to dig in, Curt.
Well, neither one of you are my therapist, but I'm owning my space around this. But
all right. Well, I think it's interesting, because I found for myself, I was actually very surprised at my result, because I felt the bias while I was taking the test. It was something where I was like, I would kind of notice it. I was very conscious. There's a part of me that's like, is my result accurate? Because I was so noticing when I was having a thin bias, and kind of trying to be I was trying to be right down the middle and really conscious of it. And I'm assuming that's part of taking the test, is that everybody's like, I want to get the best result ever, and so I didn't relax into it. I was like, I'm going to win this test. And for me, I felt like maybe it isn't accurate for me. I feel like it probably is. And in reflecting on it, and the fact that it wasn't neutral, I think my perspective has shifted. because I spend, a significant amount of time talking to HAES therapists and people who are, very body positive and that kind of stuff. And so I think for me, I noticed the stigma, and I also grew up as a very skinny kid. And at this point, if we were to look at BMI, I would not be in that category anymore. And so for me, I think I've shifted, and with my own work on accepting my own body as it is and really trying to sort through all of the pieces around that for myself, I think I may have shifted, which I hope, like, maybe there's hope for the society, but I was surprised because I felt it coming up a lot. And then there was a point at which I was like, why am I feeling that larger bodies feel more healthy to me? And then I was starting to think on where I live and where I work. And there's a lot of orthorexia and a lot of like hyper, kind of to the point of being unhealthy, kind of healthy eating, And so for me, I think there's been a shift in my perspective because I'm where I'm living. And so it was very interesting to me. And yes, neither of you are my therapist, so I'll bring this back to mine. But yeah, it was and thank you for having us take that test, because it's very interesting to think about. And there was lots of cool tests. We'll definitely put that, the link to the Harvard implicit bias tests in the show notes, because I think it's important that we look at those things.
Well, I definitely love that you both took the test and your reflections after taking it. And I would encourage other therapists to go through and take some of those and reflect on their results, because I think it might change the way that you work with certain clients in your office.
If we're not owning our biases, how does that come across to clients?
I think it can come across in that we're trying to fix them, or that we may have an agenda that we're putting onto them. And that's how I feel about it. And I think that also ties into our work that we should be doing on our countertransference.
With a specific body bias, if we're looking specifically at kind of today's topic, because I think we could talk about implicit bias all over the place. And I think that probably is a whole other episode, Curt. But if we're looking specifically at body bias, how does it show up in a therapist room? I think we've started to touch on this, but I want to really dig deep, because I think therapists may not know. I think this really is something that's so ingrained in our culture that even having a quote unquote normal office there could be some bias in how it's set up, and there could also be potentially microaggressions that are happening in the room. And so I really want to dig deeper into that, because I think for our survival guide aspect, I want therapists to get really clear and be able to assess their offices and their practices so that they can shift some of those things.
So I think let's start in the waiting room. What magazines are there? Are there magazines that talk about the latest diet, or somebody just lost 100 pounds, or they just lost the baby weight? So that's some messaging right there as a client walks into the office. Could this furniture in the waiting room support a larger body? Have you checked to see the weight that it will hold? That's one thing. Another is the furniture in your office. Do you have images in your office, maybe paintings that are only of thin bodies? So that could be something that a client may take in. And in terms of, when a client sits down, does the couch creak? Does the chair creak? That's something that I can also talk about personally is, thinking about when you sit in a chair as a larger person, is this chair going to support me? And these are all things that the client may bring into the room with them that you may not be able to get into the work with them, because they're going through, okay, is this chair going to hold me? Is this person going to be judging my body? I feel fat. I shouldn't have eaten that last night. So these are all things that can be happening in the room. And then in terms of the therapist is, how does the therapist even view the other person's body? The client says, I feel fat. What does the therapist say to that? What's the response? Is it, oh, have you considered Weight Watchers or a diet? Is it, well, fat's not really a feeling. What's the feeling under that? So to really listen and to the nuances around how they talk about their bodies, how they sit on the couch. I work somatically, so I'm constantly surveying what a client is doing, if they're tapping their foot, I call it the pillow fort, if they've built the pillow fort in front of them. So it's like protecting their stomach area. So there's a lot of different things that therapists can look for when working with a client or who has a larger body, or actually I go back to anybody because, I like to be inclusive. So looking at really anybody, but specifically with clients in larger bodies, how are they sitting? Are they sitting up straight? Are they kind of leaning over, trying to minimize? So those are some things that I would say for a therapist to, notice, and to also ask the client, what's it like to be in your body today?
Our guest today is Laura Westmoreland. She's in the Los Angeles area. She's a wonderful resource for a lot of eating disorder materials. She's very, very smart in this arena. Where can people find out more information about you?
Well, they can go to my website, which is laurawestmoreland.com. I'm also listed on ASDA, the intuitive eating site, as well as Body Trust.
And we'll include all sorts of links and stuff that we talked about today in our show notes. You can find those at mtsgpodcast.com. While you're on our website, check out the Therapy Reimagine 2019 conference here in the Los Angeles area at the Sheraton Universal City. This is a conference that is made possible by Simple Practice, and we are having like 2+ days. I'm going to call it 2+ days.
2+ days.
2+ days of modern therapist learning and shenanigans. And until next time, I'm Curt Widhalm with Katie Vernoy and Laura Westmoreland.
Thank you for listening to the Modern Therapist Survival Guide. Learn more about who we are and what we do at mtsgpodcast.com. You can also join us on Facebook and Twitter. And please don't forget to subscribe so you don't miss any of our episodes.